Liz, and thanks everybody for taking the time out this morning to check into this presentation. I'm actually amazed we just hit about 200 people, and these sessions we've had between 200 and 300 people at each session. So we're on module 4 today, animal health response to a nuclear terrorism incident. And this series is meant to provide awareness level training and provides an overview of the previous 3-day in-person version. It obviously doesn't go into the depth of that presentation, but I think it's going to be really good to have those recorded modules available for people into the future. And you can find those at the VS National Training and Exercise Program website, along with really a tremendous amount of material that's been recorded over the years. As far as the modules, we're on module 4, animal health response to nuclear terrorism incidents. We've had the 3 previous ones, and we have two left. And then the 7th one was previously recorded, and you can find it on the NTEP website. And that's the one on livestock mortality management and chemical and radiological incidents. As far as the goals of the overarching series, we talked about radiological science, radiological incidents and how they compare with animal health incidents. We talked about the science of radiation safety measurements and health effects and protective actions. We talked about nuclear power plant incidents in the previous discussion. We're going to talk about nuclear terrorism in this one, and then we're going to move on to animal decontamination, and then do a good session on long-term agricultural recovery, which I think is one of the more interesting elements of radiological response. Both Dr. Corcoran and I are members of the advisory team for environment, food, and health. And I've been on it since 2010, and Robin, I think, has been on for about 6 years now. And it's made up of members from CDC, EPA, FDA, and USDA, with other agencies as needed. We work closely with FEMA. We work closely with the Department of Energy, and we provide scientific expertise on radiation emergencies and integrate with the Federal Radiological Monitoring and Assessment Center, or FRMAC. And the FRMAC will create data products and help with data collection and analysis, but they hand off the actual recommendations part of the process to the advisory team. So today we're going to look at a number of issues. We want to look at a little bit on radiological dispersion devices, but mostly we're going to look at improvised nuclear device, or an IND. We're going to look at the personal protective actions for people in the area of a nuclear detonation. In other words, how to increase your chances of survival. We want to look at the key USDA roles in a nuclear detonation incident. We want to look at the general animal health missions in that type of an incident. And we want to look at the very challenging process of managing a large and possibly multi-state agricultural control zone, and identify some key issues related to crisis communication. So how did I get here? In 2010, we had the Fukushima disaster in Japan. I joined the advisory team at that time, and I also was asked to help co-chair the animal working group for a national multidisciplinary planning project that ran from 2010 to 2015, that included an animal work group on planning response for a nuclear detonation. And you can see this planning guidance for response to nuclear detonation. This group helped update this, and it's been updated since then a couple of times as well. And you can find that at this link. And then there's also a FEMA website on their CBRN group on various tools related to biological, chemical, nuclear hazards. So as part of that working group in 2010, one of the things we did is started to do literature searches, trying to find everything we could find that was relevant to animals in agriculture and nuclear incidents. And it was amazing the amount of material that was generated between the late 40s and the 90s. And we amassed a lot of it. And we put a lot of those articles either in links or in PDF format into this library on Zotero. And Zotero is a nonprofit academic site for, it's basically a very large bibliography tool. And we haven't updated that for a long time, but there's a lot of good material in there. That's maybe my retirement project, is to go back in and start really putting together an even better library. And then this is just an example of one of the things we found, which is this survival of food crops and livestock in the event of nuclear war, which was developed by the the Atomic Energy Commission and Brookhaven National Laboratories, with a lot of input from academics and USDA in this huge volume on just a far-ranging resource on animals in agriculture and nuclear incidents. Obviously, a lot of the planning they did was under a very stark risk of global thermonuclear war, which is really kind of makes planning for one look more doable. So anyway, so when it comes to nuclear terrorism, there's a couple of terms we want to know. A radiological dispersion device is really radioactive materials that surround a conventional explosive device. It's also called a dirty bomb. And the idea is that you've got the blast effects compounded by a radiological hazard. In addition to the blast, the idea is to create significant fear. The difficult thing is it's hard to get enough material to really do a lot of radiological damage. But in some cases, if it was set off in a high rise or something like that, the plume could get out and affect agriculture. Now, we've not seen one of these actually used, which is a good thing. But a few years back, Chechen separatists did try to detonate a dirty bomb in Moscow, but it was intercepted and foiled. The other one is called a radiological exposure device, which is theoretically you fix a cobalt-60 source underneath the seat of a subway car, to where everybody that sits there gets a pretty significant exposure. That's never been seen either, but it's a concern. And then intentional contamination of human food supply or animal feed with radiological materials is another possibility that we've not seen, except in some individual assassination situations. Then we're going to really concentrate on an improvised nuclear device or a nuclear weapon. And generally, when we talk about these, we talk about ones that are up to about 10 kilotons in yield, which is about 2/3 the size of the weapon used at Hiroshima, Japan. And we haven't gotten into much planning when it comes to the larger military weapons, although FEMA is starting to take some steps to look at that as well. So we saw this slide before in a couple times, and this is just about nuclear fission. And uranium-235, plutonium-239 are the fissionable isotopes. And in a nuclear reaction, a neutron hits one of those atoms. It splits the atom into two smaller pieces, or sometimes three. You get release of several more neutrons. And so those neutrons can also hit another atom and cause another fission. And so this creates a chain reaction. Now, if we control the rate of that nuclear reaction using moderators and control rods and stuff like that, we can create a nuclear reactor that generates power in a very controllable manner. In an uncontrolled manner, if you push two half spheres of plutonium together that form a critical mass, they'll start getting a chain reaction, and you'll get a bunch of heat, radiation, and an explosion, but it'll just blow the two halves apart, and you'll get what's called a criticality, and which can be very dangerous in working around radiological materials. But if you take and you compress those plutonium or uranium components together, typically using an explosive, long enough where that chain reaction really gets going, then you get a nuclear detonation. And if in the middle of that nuclear detonation, you infuse a lot of heavy hydrogen or tritium, you could actually get fusion on top of that and increase the yield tremendously. And so instead of getting a 10, 20 kiloton weapon, you wind up with a 1 to 10 megaton weapon. And the Russians actually set one off that was a 50 megaton weapon. So, and a megaton is, well, a kiloton is 1,000 pounds of TNT equivalent. So we want to talk a little bit about surviving a nuclear detonation. And those of you who were around a while probably remember it in grade school, the duck and cover drills. You may remember Bert the Turtle and people building fallout shelters in their backyards. But we've gotten away from that, unfortunately. And so a lot of people really don't know what they need to do to increase their chances of survival. And some of the material I'm going to use here were taken from Dr. Brooke Budemeyer's FEMA prep talk on surviving a nuclear detonation. And it's only about 15 minutes long. It's excellent. And I think everybody in this country really should view that video. And then also the CDC has their basic radiation basics series that we've mentioned before, and then a great deal of material on radiological emergencies. So, and really the mantra for nuclear attacks is get inside, and stay tuned. So if you look at a 10 kiloton blast, if you look at the area right under the fireball, the severe damage zone where there's not a lot left, that's about a half-mile radius, so about a mile across. There's a moderate damage zone, which is about another half mile to 1 mile, depending on what type of terrain you're in. If it's in amongst buildings that absorb a lot of that shock, that moderate damage zone may be smaller. If it's up higher, it might be bigger. And then the light damage zone, you're going to see a lot of broken glass and some structure fires and some falling debris. But if you look at any explosive, but in you're going to have overpressure injury is one of the big issues. And that's where there's a massive increase in pressure from the explosion, followed almost instantly by a massive decrease in pressure. And so the internal body organs are compressed very hard, and then immediately afterwards they are expanded very forcibly. And so you can get hemorrhages in the lungs and the abdomen, liver, spleen, and severe and often fatal injuries from overpressure injuries. You can get debris injury, hurtling debris, thermal injuries. In addition to radiation, there's a lot of infrared or thermal energy generated by a nuclear detonation. And so there's going to be a fireball, there's going to be structure fires, there's going to be a lot of gamma radiation generated from the explosion. There's going to be flash blindness, and that's particularly going to be a problem for people who are driving. They say most people will recover their vision within a few minutes, but a few minutes is a long time when you're going down the highway. And then one of the big challenges for both medical professionals and veterinarians after this are mixed injuries, where you have overpressure, debris, thermal, radiation, all in one animal. And then people also look at the concept of electromagnetic pulses, which occur with any large explosion. And that electromagnetic pulse, the higher it is, probably the farther it's going to go, but near ground level, I think most people have said it's probably not going to be that the electromagnetic pulse will end somewhere within this light damage zone. So, and we really don't know for sure. Anyway, we're going to look at an example of what that might look like. This is from a FEMA Region 5 nuclear detonation exercise, and this is Chicago. And if you look, that's the shock wave. This comes first, and then you have a mushroom cloud that goes up into the air for a long ways. And one of the things that happens with this fireball is it starts at the ground and moves up, drawing with it all this debris of burning and destroyed material up into this fireball, where it becomes really in a molten state, but it's also bombarded with neutrons that are generated from the nuclear fission. And those neutrons induce radiation in the stable elements in that debris and make them radioactive. And the challenge is that they are typically very short-lived radionuclides, and so they decay rapidly. But that means there's going to be a very high level of radiation in the initial days of the incident, or actually in the initial hours. And so you see all these particles that are highly radioactive are going up, and these things range from about 1 centimeter, which will drop pretty quickly, out to about 50 microns, which could go quite a ways. And they'll contaminate the ground. And so at the end, what we have is this dangerous fallout zone on the ground. And if we look at that in another type of map, this is a typical FIRMAC data product. And it's looking at the dangerous fallout zone in a nuclear detonation scenario for an exercise that was downtown DC explosion. The dangerous fallout cloud goes to the north and east, almost out to APHIS headquarters in Riverdale. And this line here is the line that the computer estimated the 10R per hour area would be, which is called the dangerous fallout zone. Now, it doesn't mean there isn't radiation out here that's harmful, but it just means this line and inside is greater than 10R per hour. And if you get close in, it's a lot more than 10R per hour. And so this is very dangerous and not a good place to be, especially if you're out in the open. But if we go to 6 hours post detonation, all of a sudden now, instead of being, I think it was 80 some odd miles long, it was 42.6 kilometers. Now it's 12.5 kilometers with just 3 hours. Now there's still radiation fallout on the ground here, but it's just not as high as 10R per hour now. So let's go out to 12 hours. All of a sudden, it's quite a bit smaller, only extends about 3.4 kilometers. And if we go to 48 hours, it's now at 0.4 kilometers. And it actually is within that major damage zone. And it says population there is 0 because there probably are no survivors in that zone, or at least very few. So I think what that tells us is that there is a strategy for surviving being in that dangerous fallout zone, and that's to get inside and stay inside until you know it's safe to come out. And when you look at where to go, you want to go to inside. You want to get to the most substantial structure that's readily available, because you've probably got about 15 minutes to get inside. And then if you go inside a wooden frame house, you get a protection factor of 2 to 3, and these are like SPF numbers. It's a relative protection. But if you're able to get into a larger building and get into the core of the building, you'd have a protection factor of 100, or if you were down in the basement or sub-basement, you might have a protection factor of 200. And where that fallout is going to land, it's going to land on the roofs of buildings, it's going to land on the ground, and then some might adhere to the outsides of the building. And so staying away from the walls, staying away from the roof, and staying away from the ground is really where you want to be. And FEMA's estimate is if everybody did this, you wouldn't have any fatalities in the dangerous fallout zone, except for those that were up close to the blast and, were, initial casualties. So, but the problem is, if you decide that you need to leave work, you need to get in your car and drive to your kid's school and try to pick up your kids who are probably down in the basement in a safe place, what you might do is drive through this dangerous fallout zone and get a lethal dose of radiation and not have done anybody any good and done a substantial amount of harm to yourself and your family. So this is really such a key thing to know. And you don't need to stay here for, not like the science fiction movies where people stay in their fallout shelter for 3 decades. I mean, you can see by 12 hours, there's a dramatic decrease in radiation. By 48 hours, it's really, really down to just a small fraction of what it was. And so staying inside for at least 12 to 48 hours and waiting for some sort of a communication, if you're, and the dangerous fallout the upper atmosphere where that's coming from, because that fireball will go several miles in the high, it will go several miles high. But if you're not sure if you're in the dangerous fallout zone, you probably should take shelter because ground wind and smoke may not tell you where that upper atmospheric flow is. So if you're upwind from it and you get in the shelter, you're going to find out after, an hour or two that, no, it's safe, you can leave. So, and if you look at an airburst detonation, this is a photograph from, I think, the Hiroshima detonation. You can see that instead of this plume of debris from the ground being mixed in the fireball, there's actually an open air length between the two. So the fireball sucked this up, but it didn't get sucked in the fireball. And so that means that you're not going to have a tremendous amount of fallout from a high air burst. And because of that, this is a picture from Hiroshima that within a day, people were coming in as responders with very little residual radiation in the area, which was at least somewhat of a blessing. And then if we look at that same building, this is the Peace Shrine at Hiroshima. So, and you can see that the city is now a modern city and completely rebuilt. So we want to look at response now. So it's going to be a really big incident. There's going to be local, state, tribal, territorial, all affected jurisdictions are going to have their disaster declarations in place, and probably certainly multiple locals and probably multiple states, because that fallout cloud and agricultural plume can go a long ways. You're certainly going to see a presidential disaster declaration. The president also has the ability to use the Defense Production Act when it comes to key resources, critical infrastructure, including agriculture. And it's possible along the way the Secretary of Agriculture could declare an agricultural emergency, but we really don't know whether that'll happen or not. It could. So if we look at USDA roles, this is similar to what we've seen before. Agricultural damage assessment, supporting the management of contaminated pets and livestock, including animal decontamination, animal mortality management, and culling. Disposal, food safety and security, sample collection and management of contaminated agricultural lands, monitoring of food systems, and this is going to be a really big deal. We'll talk a little bit more about that in the recovery part, and management of trade impacts. And another really big part of response for USDA and every federal agency and a lot of states is going to be supporting general emergency management missions through ESFs, emergency support functions, and through their states. So what is there going to be to do? And we worked on this a lot in the IND work group, and we really felt that it was going to be a huge incident from just the animal and agricultural perspective within an incident that's even more catastrophic when you pile in everything else. And so typical response elements, assessment, evacuation, relocation, mass care sheltering. There's going to be a lot of sheltering in place initially that needs supported. There's going to be a lot of people without utilities because of utility and power disruption, et cetera. And there's going to be a need for decontamination of animals, veterinary care, animal search and rescue. Although animal search and rescue will not occur in the dangerous fallout zone or any zone until those radiation levels have gone down to where you can safely go in there for an extended period of time. And then we also need to be looking at animal facility management, zoos, aquariums, research facilities, et cetera. On the agricultural side, there's going to be everything, there's going to be some livestock, particularly non-commercial livestock that are involved in this as well. But we've got the food supply protection, the establishment of the agricultural control zone, movement controls and hazard regionalization, depopulation and carcass removal, and then maybe some livestock decon, just depends. And then monitoring the food supply is going to be a huge and ongoing issue. And for instance, over here, animal search and rescue, one thing I want to point out is in a catastrophic incident like this, you may have people who were casualties, either injured or killed in the incident, who aren't coming home anytime soon. And they may come from all over the region. So even cities from outside the actual disaster zone may find that they have a lot of issues with animals and children who are now don't have adult caregivers. So let's go into the first one we want to talk about a little bit, which is evacuation and relocation. And evacuation is exposure is expected for 1 to 5 rams or 10 to 50 millisieverts expected over 4 days. And in the dangerous fallout zone, there's going to be a lot of sheltering in place as an alternative because they need the shelter in place until that radiation levels falls enough to where they can get out safely. Unless they're farther out, it could get completely out of that zone where that fallout is going to come down. And that's where communication becomes so critical in these types of events. Relocation is different. It's looking at an annual exposure. So if you're going to get greater than 2 REMs for the first year or 0.5 REMs for the second and each additional year, then they're going to ask you to relocate from your home. If you combine evacuation and relocation, this could be some really huge numbers. This is another exercise FERMAC data product. And if you look at this bigger area is the 1-year relocation zone. And this starts in Washington, D.C. again, goes all the way up well into Pennsylvania, north of Harrisburg. And this total population there is 875,000 in that area. And some of it's rural area too. And that has extent of 183 kilometers. Now for the second year, it's down to 86 kilometers and 395,000 people, but that's still a really big issue. And this is going to involve people, that's going to involve animals, it's going to involve backyard livestock and production agriculture as well. So we really need careful public instructions. We need to let people know when they need to leave and where they need to go. And if there's a dangerous fallout zone, we want to make sure that people don't drive into that trying to get out. We know somebody will do that probably, but we don't want that to happen. Their community reception centers are going to be set up, and they'll be able to help people assess what kind of dose they may have received. They help them with decontamination, including their pets, and they may bring other animals as well. Reunion efforts, in other words, children who shelter in place in a school probably going to be moved in mass to a community reception center to try to facilitate reunion with their parents and family, and then transition people to mass care shelters or private accommodations. And for relocation, the one thing that we've seen is people that really want to jump the gun on relocation, you know, tell them to get out now. But really, you really need to give people some time to do that, because they may have things to do to their home to get it ready to be vacant for some period of time, and to collect what they need, and et cetera, et cetera. So when it comes to animals in the evacuation relocation zone, there may be the ability to go back in there, except for the dangerous fallout zone, and for a certain length of time for basic husbandry. So if you have an agricultural producer in the relocation zone, they may be able to go in daily to provide care for their livestock, pending deciding what's going to happen with those livestock. You're going to have to remove animals that are stranded and trying to get them to their owners. And this could include decontamination, and could involve some search and rescue to identify animals that were left behind and nobody's coming to take care of them. And eventually return to owner or adoption. And food animals, the agricultural control zone will actually be much larger than the relocation zone, but the animals in there, we may or may not be culling all those animals. So that's something we'll get into a little bit more later. So animal decontamination, we said community reception centers. There's probably going to be military support within a 48-hour period to get there to start helping with those community reception centers and decontamination people. But the animal decontamination is going to be managed by state and local response resources. And we'll talk about this, the whole process of decontamination, a lot of the issues and challenges in both building an animal decon team and managing one. So, and then we want to talk just a bit about animal facilities and zoos, aquariums, research facilities. I think these are pretty obvious, but when you think about it, a zoo or aquarium or some universities that have facilities that have a large campus, not only are they going to potentially have to shelter in place if the dangerous fallout zone is going to affect them, they may have to shelter not only their staff and the students, but visitors, the public. And so a zoo might wind up with hundreds or even 1,000 visitors that really need to shelter someplace substantial for a day or two, that might have to, the zoo might have to take care of them. And so this is some of the things that we worked on in the contingency planning work group with the zoos. And but also just worth noting that under the Animal Welfare Act, we require them to have contingency plans for USDA regulated facilities. And you know, at some point in time, do you shelter animals in place? Do you try to evacuate or relocate them? And it's all situationally dependent. As far as agricultural response, this is someplace I've really focused on for the last few years that is really a challenging issue. And it immediately, not only is it a local incident with many local jurisdictions and with state, tribal, territorial incidents, maybe multiple, it's a federal and national incident. It's an incident for animal industry and non-governmental organizations. And it's a domestic and international trade incident as well. And FEMA has this document called the Whole Community Approach to Emergency Management, and it really resonates well, I think, with emergency managers, that it takes everybody working together to make an effective response and recovery. Now, this particular document doesn't really talk much about food and agriculture at all, but I think the philosophy can be applied, and we need to get everybody on the same page. And while local jurisdictions may have certain authorities,
Sorry, I didn't hear anything. Please enter your 16-digit account number.
I'm not sure what that is. but
I think somebody's not muted.
yeah. So anyway, we have we have a lot to think about in those first few days, is trying to develop a coordinated response. Developing the initial agricultural area of concern is really the first step, and that's going to be based on partly FIRMAC model from the existing data, including weather data, the size of the detonation, the radionuclides present, and sometimes terrain features, et cetera. And but it's going to be much larger and potentially involve multiple states. And we're really going to have two different plume areas. One is the radioiodine plume, which could easily involve multiple states. We've seen them on maps be over 1,000 kilometers, and dairy and mature produce are really the highest risk. And other types of agriculture may not really be dangerous in those areas that are just a radioiodine area. And with that 8-day half-life, it means it's down to 1% after 2 months. So really, in less than 2 months, the radioiodine hazard is pretty much gone. So there's a need to figure out, what are we going to do with this? And then the radiocesium, radiostrontium, and other longer half-life radionuclides are going to be in a smaller area, but with a 30-year plus or minus half-life that we're going to have to manage for a long time. So first thing we have to do is validate the area. We're going to have some modeling. We're going to have to start with. We're going to start getting some ground tests in various places. We're going to see a flyover by the AMS aircraft, and they'll do this serpentine flight pattern. And I think the one you saw for the nuclear power plant, it was a very tight pattern, but in such a big incident, they need to get a lot more coverage quickly. And so you'll see some of these bigger loops, and it should give us a pretty good idea. And the nice thing about this not only can tell you how much gamma radiation it's being picked up, but it can sense the energy of the gamma rays and tell you if it's radiocesium here and radioiodine out here, and what the mix is across here, and other radionuclides as well. We want to start getting some agricultural samples, and we want to use dairy, and we want to use mature produce ready for harvest, or plant material. If it's this time of the year, there's probably not much mature produce ready for harvest in much of the U.S., but even leafy weeds could be something that could be at least tested to validate the area. The dairy industry, we not only need to test dairy samples, but we need to get a history of their management practices too to go with that. And laboratory capacities can be very challenged at this point in the response. Everybody's going to want samples from a lot of different things. And so we're going to have to wait to test a lot of other types of agriculture until we get the bandwidth in the laboratories to start doing more of it. So it's, I'm sorry, this is a serpentine pattern here that we saw. We saw a really tight one for the nuclear power plant incident. This one goes out for many miles and has a broader loop to it. So, but they're very useful. Actually, the U.S. aircraft went to Japan and helped them with characterizing the incident there. So we need to provide context for our agricultural samples. And Robin touched on this a little bit the other day. If you've got a dairy that's a dry lot dairy, they're not on pasture at all. Their feed supplies are covered and they're on well water. Even if they're fairly close in, you may find that that milk isn't very contaminated at all. Versus if you have dairy cows that are out on pasture, they have access to pond and streams, they have feed stores that haven't been covered, then you can see some pretty high levels in the milk. And this is the latter part here is what that deal is, or excuse me, those protective action areas of concern are based on. And when you look at a swine unit, if you've got an indoor covered feed, well water versus a free range unit like in this USDA picture, I mean, you can expect to see different levels. So make sure that when you're testing, you not only collect the samples, but you have somebody capture that information about what's happening at that facility that you need to know about. Now, with mature produce ready for harvest, I mean, you need a location and some basic information, but you're probably not going to change much. Okay, here's a picture of the agricultural area of concern for dairy and mature produce ready for harvest, and they really are the same area. This is for radioiodine only. Extent is 1,065 kilometers, starts in Pittsburgh and goes all the way out to the Atlantic Ocean, and it would have gone into Canada, but they kind of curtailed it. So it affects Pennsylvania, New York, and every New England state. So I don't know how everybody on this call feels, but even if we do a good job, just coordination of all the information and decisions and decision-making processes across this area is going to be a big challenge. So luckily, this is a 2-month half-life, and so actually in less than 2 months, the whole area will be shrinking down considerably. And so do we start euthanizing cattle, dairy cattle up in these areas? My suggestion would be is if they are on clean feed and water, if they are not on pasture, if we can get them off pasture, maybe we don't need to euthanize anything that's out very far in this deal, maybe up closer, but it would seem silly and almost like cutting off your arm for a hangnail to euthanize dairy cattle, particularly those that were that we'd invested protective actions and they really weren't getting much of an exposure. I mean, none of the people are leaving this area. So, those dairy cattle, it's not affecting their health. It's just a concern about the worst case scenario of bioconcentration of iodine 131 into the milk. Okay, so let's look at cesium 137. This is the areas of concern for that need to be validated. And this one is 89.7 kilometers for dairy and a little bit less for mature produce. Often they're more similar, but it just depends on the scenario and the data they feed into it. This is a nice narrow plume, which is good. But we just need to be able to start getting some testing here. If we have dairies in this area, we definitely need to test them, but we also need to know what their management is. A lot of this area will be evacuated too, which will be a challenge. Evacuated or relocated. So, there's going to be some key challenges, but we just need to get that testing started, and eventually it becomes a soil contamination incident, because all the contamination going into the livestock and plants after the first little bit all comes from the soil. So what do we use? We use FDA derived intervention levels, which are very conservative values based on the EPA Protective Action Guide of trying to prevent 500 milligram additional exposure to the public from the diet for the course of a year. It has some assumptions that 30% of the diet is contaminated. And if you think about it, how many people get 30% of their diet locally? And the answer is not many, except for people that are maybe doing some subsistence gardening. So our food comes from some local, but a lot from all over the country, and in fact from all over the world. So this may be a pretty conservative value. We use the most restrictive age group limits, for instance, like with cesium 137 and for iodine 131, it uses the infant child who's drinking a lot of milk as part of their diet. And there's also some transfer factors involved in these, and how much is actually absorbed from how much is in the food, et cetera. And there's some information there on where to go look up more on the DILs. If we look at our DILs, and I think Robin showed the same slide, I mean, we the US uses a very specific DIL that's calculated for each radionuclide. International Atomic Energy Agency puts everything into a log of 10. So 1, 10, 100, 1,000, 10,000. Every radionuclide gets assigned to one of those categories. And so it's not unusual to see ours is slightly higher, but from a functional point of view, these are not significantly different. And we'll talk a little bit more about how that may impact international trade in a little bit. So, so if the DILs are safe, are lower levels even safer? And the answer is, if you look at the current research in low-dose radiation, the amount of exposure that we're seeing from the DILs, even if it's 500 milligrams a year, which is the maximum that we estimate would be happening for people that are eating 30% of their diet contaminated at the DIL. If you look at current low-dose radiation research, it doesn't show a high correlation with increased cancer risk until about, now this is my opinion, but a lot of people feel it's when you get to about 10 rems is when you start seeing a measurable increase in cancer. That's Kevin Dennison talking here. And what it really means is the worker protections and the PAG manual really are, in my opinion, very conservative. And if we do lower those DILs, we need to understand what's going to happen if we do that. Now, we might have to adjust that standard related to export, because if the international DIL for cesium-137 is 1,000 and ours is 1,200, we may have some trade discussions in some countries that are uncomfortable with us using 1,200 instead of 1,000. I think that's a legitimate reason to go back and revisit that. But if you decrease that DIL to 100 from 1,200, which is what Japan did, or excuse me, from 1,000. So they decreased their allowable levels down to 100 from 1,000. And what it did is it impacted the economics and the direct impacts to producers in rural communities severely. And I think there's a good reason to draw a correlation between those severe economic impacts and mental health impacts for producers, including a known increase in suicide rate after this incident in Japan in the agricultural community. So we need to understand that sacrificing that if we decide to make people feel safer, but in the process we're sacrificing lives and livelihoods of people, we need to be really careful about what we do there. So we're going to go ahead and move on here. And so now we've identified an area of concern. We've sampled enough agricultural products to validate or modify that area of concern. We've identified a single large area that reflects everything, including radioiodine, but we've also looked at a small area that we know that we're going to have to deal with for a very long period of time. So, and in the larger area of concern, you may have an awful lot of types of agriculture that get released immediately. It may be just dairy and crops that the agricultural control zone is using, and some of those dairies may be released to sell by permit because they really aren't getting much contamination because of the protective measures. So we need to establish a coordinated agricultural control zone boundaries in each state. And you can't just draw that plume on a map and say, well, here it is, because if you get out into a rural community and here's a theoretical line, where is the actually beginning and end of that line? And so same as with nuclear power plants, we have to find highways, political boundaries, rivers or streams, other geographic features, something that we can communicate clearly. Almost always that agricultural control zone winds up being somewhat larger. Sometimes it's initially much larger because there's just no clear way to communicate the boundary. And in that case, if it's much larger, it may mean you have an opportunity to go in look at some agricultural producers that really don't need to be in there and put them on a production by permit basis on a one-by-one basis. Got to communicate those boundaries vigorously, do enforcement. There's got to be interstate coordination, and then protective action recommendations pertaining to household gardens and backyard livestock. So, you know, the whole community concept in agricultural control zone management and enforcement is there. It takes law enforcement, media, industry, all the farm to fork type stakeholders. We need clear science-based messaging, and anything that's coming out of that agricultural control zone really needs to be moving by permit. And luckily, we've been using permits a lot for avian influenza, for virulent Newcastle disease in California, and so there's at least some infrastructure for going to a large-scale permitting process. When it comes to livestock in the agricultural control zone, you know, a lot of the animals in there that aren't dairy can be released pretty quickly or put on permit-based production. Some culling as we get closer, particularly in that cesium strontium area and areas that have a lot of radioiodine, or animals that have, you know, didn't have their intake mitigated initially and had quite a bit of radioiodine in them. And there's going to be disposal and indemnity, and we'll talk about that in the next one. But indemnity is a big question mark since nuclear power plants, American nuclear insurers aren't going to be involved in this. It's going to be either in the Stafford Act or possibly under USDA funding. And the leadership and lawyers of FEMA and USDA will get that figured out. And we may need to retain some of those livestock for research projects. I always want to get that in there because it's, I think it's important. There's no World Trade Organization or no World Organization for Animal Health trade framework for radiological incidents like there is for animal disease incidents. So actions or inactions may have broad impacts. We need that whole community approach. We have to do trade negotiations with a lot of different countries individually, and it could get really, really complicated. At risk are millions or even billions of dollars in U.S. agricultural imports, or exports, I mean, and the better we do on that agricultural side, the less damage we're going to see economically, particularly to those products that just, they're fine. They're not contaminated. They should be free to move, but there still has to be that trade acceptance. And to top it all off, we haven't done this before. We clearly aren't going to have all the policies and statutes and SOPs in place to do what we need to do, but we're going to have to adapt and learn and move forward. And lastly, we're going to talk a little bit about crisis communication, which this is the part of the incident that if you do a great job on response and science, but do a terrible job on communication, it's going to look like you did a terrible job. So maintaining maximum transparency and clear messaging, it's a technological incident. We have to enhance the public quantitative view of radiological risk. It isn't attack of the 50-foot woman or the incredible shrinking man from radiation. It's a measurable hazard that we can manage, and we don't have to expand the risk for very, very low doses. We need to continuously describe food safety efforts and address misinformation pretty vigorously. There's going to be mistakes. The international units versus the U.S. units really lend itself towards confusion. There's going to be mistakes on the risk related to that and other reasons. You're going to have people with zero radiation perspectives. They don't want any radiation in their food. And guess what? There's already a lot of radiation in their food. It's potassium 40. Their own bodies have 5,000 becquerels per second worth of radiation being emanated inside their bodies. So we can't really function in a zero radiation perspective. And then there's going to be intentional misinformation. This is another helpful product from FEMA on communicating the aftermath of a nuclear detonation, and has a lot of good messaging. It does pets and companion animals, but it doesn't really have much on agriculture. So one voice, we have a bunch of states, a bunch of local jurisdictions, a bunch of federal agencies, lots of stakeholders. How do you get coordinated messaging? And it's going to be a challenge. And in Fukushima, the White House really wanted executive oversight on all federal messaging, which really slowed down the release process and frustrated some states. So don't know what that will look like, but it's going to be a challenge. And then social media is not going to be, obviously we can use social media to get the message out, but you can expect some alternative agendas and some really egregious misinformation. And this little slide here shows a NOAA wave map from the Japan earthquake. And it shows the tsunami waves and where they went. And if you follow this little line that comes into the West Coast to Crescent City, it's a trough out here that generates a higher amplitude tsunami waves right around Crescent City. And they always get a foot or two higher tsunami waves, and actually had some substantial damage in 2010. But if you look at this as an example of the numerous products out of troll farms or people with alternate agendas who were showing, this is the West Coast of the US in 48 hours, we're going to get 75 REMs. Well, we had a fraction of a millirem in radiation coming to the West Coast of the US. So, this is in error. And in fact, a few days later, there was another one released that showed getting like 750 REMs out this far, which is enough to kill more than half the people in the western half of the United States. Well, obviously it didn't happen. And it's labeled U.S. Nuclear Regulatory Commission, which is totally fraudulent. And this shows the melted reactors, the breach reactors in Japan, but they're all in 1 kilometer or so section all together with 6 reactors, and 4 of them eventually had problems. And so this was wrong. And then here's our NOAA wave map labeled as the Pacific Dead Zone. And obviously the solution to pollution is dilution. When that cesium and strontium and other radioisotopes hit the Pacific Ocean, they actually distributed pretty quickly across it. And I think in salmon in Japan, they saw about a 1 becquerel increase in cesium-137 in salmon, which, given the 1200 becquerel safety limit, is nothing. So, just be aware that we are going to get things to deal with that are intentionally designed to create public fear, misinformation, and distrust. So, and I think the last slide here is about societal impacts. We have, those that are direct survivors and responders to the scene are going to, we're going to have to deal with a lot of critical incident stress. People that have to evacuate or relocate, same thing. Everybody in the country and many people across the world are going to have this vicarious trauma about this incident. And in agricultural communities, we're going to see a lot of impacts. We're going to see people outside the control zone that have trouble marketing their product because they're near the control zone. And so we need to find ways to not only effectively manage food safety, but we also need to find ways to effectively help with the resilience and the economic and social recovery of agricultural communities. And the thing that we really want to do, it goes back to the veterinary oath of above all, do no harm. We want to try to not make things worse by making expedient decisions politically that look good but make things worse. So we'll see. So in summary, catastrophic incident, but if you're anywhere in the area, there's things you can do to save your own life and help save the lives of others, that you can get to do the right thing. Those people that jump in their cars and get stuck out on the highway while the dangerous fallout cloud passes over and kills them, it's that'd be really sad. When it comes to animal and agricultural emissions, it's going to look a lot like other disasters, but increased in scale. There's probably very little we're going to do in a radiological incident like this that we haven't done something similar in another incident, whether it's an animal health incident with a disease or whether it's a hurricane, et cetera, et cetera. And then there's going to be a lot of complex scientific policy and communication issues, and recovery will take a long time. And this is going to be a marathon and certainly not a sprint. So just to give you a preview, we've got some things coming up in the recovery module after the decon module. And we'll be going through a lot of these things. And in particular, it's the agricultural mitigations I find really interesting. Short-term and long-term soil mitigations, and how to really help agricultural land recover and become useful again without being a hazard. And then, of course, community recovery. So with that, here's my contact information, and I'm happy to look at questions.
Thanks, Dr. Dennison. That was great. We do have a bunch of questions. Thank you, Robin, for answering some of them. One that's in here is for decon, it is said that the responsibility lies on the locals. If locals don't have the capability and state/fed has planned for locals to do the decon, what then? It seems everyone is expecting the other to do the work. And how can we address that?
Okay, you just won the $64,000 question. Which unfortunately, because it's a federal agency, we can't give you the money, but we'll just put it back in the general budget. Anyway, this has been an uphill battle for a lot of people, including myself, for the last couple of decades. In a nuclear power plant incident, we might get tens or hundreds of pets potentially, and that's more doable. In a nuclear detonation like this, you might have hundreds, thousands, maybe tens of thousands of animals to deal with. And we just don't have that many decontamination teams. We have gotten some resource typing. There's a number of communities, particularly at state levels, that have animal decontamination teams now. EMAC is one potential source of getting those teams in, but it's going to take a few days to get somebody there. And one of the worst, the most pressing need may be very soon. So the question is, how do we fix this? And every time we have an IND exercise, it gets brought up as a gap or a delta, and it gets written down. And we really need to put more resources into this. And I think we'll talk a lot more about this later, but really communities need to start investing in all hazards animal decontamination teams. If more communities had these across the country, then we would have more capability through mutual aid. We do not have any teams in USDA. HHS has the National Veterinary Response Team, but their mission is to provide public health support and veterinary medical support. They're going to need to be there to support decontamination and other missions, but they can't just do animal decontamination. So it is a huge gap, and I'll get off my soapbox. I agree.
So the next one is, does USDA have processes to inform USDA-regulated food production/processing facilities that a radiological incident has occurred? And what steps they need to do to prevent potentially adulterated food products from getting to the market?
Well, there are, when it comes to USDA meat inspected plants through FSIS has immediate communication with all their facilities. And so their role on the food safety side will be just absolutely huge. And so, yes, they're going to have to notify those processors. Now, most of them are going to see the news and have a really quickly understand what's going on, but they need to be told, what does it mean? And we're going to have a lot of work in proving the negative. In other words, here's a bunch of cattle coming into a slaughter plant. How do we know if any of them are contaminated? And so there are mechanisms that are available to do that, but we are not ramped up to do that on short notice by USDA, and I know FSIS doesn't have immediate capabilities in that vein. We'll actually talk a little bit more about that in the recovery part.
The next question is, with the ban on nuclear testing, is there any modern day radiological research being done to study effects of an incident such as these? I'm interested in knowing if we would have a better understanding with modern technology compared to the tech used in the nuclear testing era.
I'm not sure I totally understand the question, but I mean, our monitors are better. I mean, they're all digital now instead of old analog clunky things. They're pretty sensitive, and we will talk about equipment, but not a lot. I mean, every decontamination team needs to have their own monitors for scanning animals because they're going to be in great demand, and if you don't already have them, it's going to be hard to get them from somebody. There's, the simple monitors for animal decontamination are pretty easy to use, and with a little bit of training, it's pretty, it's really not rocket science. So I don't know if I really answered that well.
We have put all the links in the chat. People have also added additional links. There was some questions regarding potassium iodine. It is not an anti-radiation pill, only for radioactive iodine isotopes. Anyone considering taking KI should discuss it with their doctor. The NVS does not carry potassium iodide for USDA responders to take. The only human countermeasures we carry are antivirals and must be coordinated through local boards of pharmacy or public health. And I don't know if the CDC Strategic National Stockpile carries it now. Radiation research effects are ongoing, but it's a tight, small community. The best source on human effects remains the UN SCEAR, the UN compilation of the radiation effects of the Japanese atomic bomb. There's a link in there. And the last one is, has USDA looked into any sort of radioprotective drug for livestock? Also in regards to mitigating techniques for soil, are there any type of crops or plants that are efficacious in taking up radionuclides from the soil?
Okay, well, let me run down that list. Just a comment on potassium iodide. It's, for those veterinarians out there, it's a competitive inhibitor. And so if you are going into an area where there's iodine 131 out there, if you take a bunch of iodine, it keeps you from absorbing that iodine 131. It's a really simple process. If you go out there for a couple days, absorb a bunch of iodine 131, and then come back and start taking potassium iodide, it does very little for you. It doesn't do a thing for any other radionuclide. So, there was one research article, and I'd really like to find funding to try this out on a more controlled environment, where they took one dog and they were testing potassium iodide, various versions of iodine orally as for radioprotection. And the one Doberman, they shaved a spot on the back of his neck and they put betadine on it. And they found it was about 80% protective if used before exposure to potassium iodide, because you absorb betadine through your skin. I always thought that was the greatest little mention in an article back from I think the 50s, and that nobody's followed up on. Could we just have people put some betadine on their arms and, in an emergency, and maybe that would help. So, okay on that. So as far as the next one was about, I'm having mouse problems here. I got two screens up.
Has USDA looked into any sort of radioprotective drug for livestock?
Not protective. There's been some looking at, there's a radiogardase is for people. It's a product that binds cesium in the intestinal tract and helps pull cesium out of the body. It's really a high quality Prussian blue, so it's used as a paint dye, and it's not toxic. It doesn't absorb into the body, but a lot of the paint dye isn't very pure, and so it may have other stuff in there that you don't want to eat. But in Europe, they actually used a highly purified version of Prussian blue to use on livestock. Now the question is, would we use that on livestock here? And FDA is really reluctant to really get into a discussion of using a drug on food animals that's not had any real testing on livestock. And now we could use bentonite clay. It'll do kind of the same thing, not as effective, but it's tastes like dirt. Hard to get them to eat it. So yeah, there are some things we could do when it comes to animal decontamination for non-food animals. I mean, there's a lot of drugs out there that can be used to remove toxic elements from the body. And for almost every radionuclide, there's a treatment for removing it from the body. It's just that it's typically not approved for animals or used in a narrow framework, and can be really expensive and probably not available for food animals at all.